Welcome to MyMacDLife, and powered by the Support Sight Foundation. This podcast is about macular degeneration and the devastating impact it has on millions of people and their families every single day, 365 days a year. Our mission is simple: to bring hope, optimism, perspective, and education to our listeners. So tune in, buckle up, and put your listening ears on.
Support for today's MyMacDLife podcast comes from Healthy Vision Association, Novartis, Vispero, Centric Bank, and Hinkelstein & Associates. Thanks for joining us. We've been on this path to advocate and promote a new resource out there for people and families and caregivers who are impacted by macular degeneration, or as we like to call it on the show, MacD. And that amazing resource is amdcentral.org. amdcentral.org. You got to check it out. You got to tell everyone about it. And with me right now is one of the founding partners, like the Support Sight Foundation, just to remind people, and a colleague I've known for a few years and I have a very high regard for. And I am really excited about Kira Baldonado from Prevent Blindness joining us today to share her experience in helping to build this incredible resource, online resource for millions of people to access, and also to talk a little bit about the organization that she is so dedicated to, and that is Prevent Blindness. Kira is the Vice President of Public Health and Policy, so I am definitely going to ask her to weigh in on some of those topics because this disease is bigger than all of us. This disease impacts, 1 in 4 over 65, and this disease is serious, as you all know. And so advocacy on the public health and policy level is critical to get the funding for resource sources and research and all those important things to eradicate it. So Kira, welcome. Thank you so much for joining us. How are you?
Thank you for having me here. It's good to see you.
You too. Well, we can't really see each other, but let's act like it.
Okay. Well, good to be here.
We
Thanks
can
for having
envision
me on,
each
Dawn.
So let's get started. I want to dig in. So let's start out with some information about Prevent Blindness, your mission. Share that because a major goal of my MacDLife podcast is to inform the public, to share resources, to empower people. And we want everyone to know who's out there really in this vision space advocating for them. So why don't you talk a little bit about Prevent Blindness and then how and why you decided to join and become a founding partner of AMD Central?
Sure, thanks. So a little bit about Prevent Blindness. It's a pretty old organization. We were founded in 1908. With the mission to prevent blindness and preserve sight. And that is our mission yet today, to prevent blindness and preserve sight. The organization was founded way back when on a public health issue. Back in New York, there were a lot of immigrants coming to the country at that point in time, and not everybody had access to health care. So there were a group of nurses that got together and found that there were children being born and ended up being blind because when they were born, they received an STD. From the mother during the birth canal. And so they found that if they put antibiotic drops in the child's eyes, and at that point in time it was silver nitrate that was used, then the children did not go blind. And that use of eye drops when children are newborn still continues today. So that group of nurses changed the public health policy, changed laws so that it became a standard of care. And then they gradually worked their way through other states across the country to create a standard of care. It was a group of a group of plucky nurses, group of women that changed policy. And so we started with a public health mission, and we still have a public health mission to our organization today. Certainly, we've expanded beyond just looking at issues of infant blindness to address any vision issue of any age group. And the uniform umbrella for our organization really is that we are driving to implement changes at the programmatic, at the policy level, at the standards level to make sure that we can prevent vision loss wherever possible, or we can improve the quality of life for individuals that do have vision loss. So that's our uniform umbrella, working to improve systems of care, working to elevate the experience of the individual with vision loss so that they can share their story. And together, through partnerships, we can improve what happens with vision across our country.
That is huge. That's huge. I love it. It's huge.
It is huge, but gives us a lot of opportunity to partner with great organizations such as Support Site. So our organization is a national organization. We have affiliates in 6 states, and we also have programmatic offices that serve Illinois and a regional office that serves the Northeast region of the country and 5 states there. So we have a national footprint and do a wide range of services. We have services that provide access to eye examinations and eyeglasses for people that cannot afford them or don't have the insurance coverage. We do still quite a bit of advocacy, working to advance policies that support vision research, that support public health surveillance of vision, and work to improve access to rehabilitative services for people with vision loss.
So your thumbnail, and just not to interject, but I think what we want people to know is that even though this is the focus of the show is macular degeneration, you span many, many eye diseases. And I think what we want to share with them is we want them to go to your website.
We certainly do.
To, learn more about your organization and get involved, right? And you're located in Chicago, headquartered in Chicago?
Our national headquarters is in Chicago, Illinois. And they can certainly traverse over to preventblindness.org, preventblindness.org, and find out all of the different ways that we work to reduce the incidence of vision problems. Certainly that of MACD is one of our central issues. Everything that Prevent Blindness does in these areas really is most effective when we work with partners. We know we can't do everything on our own. So it's really important for us to work in partnership with other organizations that focus in this area to make sure that we build the resources that the individuals need. So that was why we joined the experience with building amdcentral.org. Go there. And it's really important for us to work with our other partners in the vision community to provide the resources that support the patients, the individuals, the allies that are supporting the health of these individuals to make sure that information's out there.
Well, that's perfect. First of all, I love your mission. Prevent Blindness plays a role, I believe, that no other organization does. So, and you do it very well. So we encourage people to check it out. Check out preventblindness.org and all the resources. How you activate this community is a really big deal. So thank you for that. Talk about what the experience was like for you to work with the other founding partners and to collaborate for the very first time on this project. What was that like?
So the experience for me was one where we came in with organizational focus, I think, thinking about all the things that we do, and had to transition with the other organizations to what the user needs. And with that, we have to strip away the labels that we put on things, and we have to strip away the packaging and the marketing that we impose on ourselves to make us who we are, and create a resource that's really about what the individual needs, meaning what do they need to learn? What do they need to be aware of? What do they need to connect to? And so the substance really becomes the focus. And I think we had to evolve a little bit to get there. and figure out how we were going to work together to get to that. But the result is amdcentral.org. And you find that you're searching for substance, not so much packaging and prettiness,
That,
which is important.
that's a great way to put it. I love that perspective because I agree. We had to kind of strip away the individual important missions that we all have, right? Is what you're saying. And then come together on behalf of the patient, the caregivers, and the families, because ultimately that was the goal, is to provide one place where they could go when they're diagnosed with MACD, AMD, or they're living with it, but where could they go easily, right? And conveniently to get the best, most credible information. And it was because we're all doing it. So if you were to sum up AMD Central and the role that it plays as a resource, because you're very involved in a lot of collaborations, like you said, a lot of coming together of resources on all types of eye diseases. But if you were to sum up, or I would like you to sum up why you think this resource was needed, why you believed it needed to be built, and what you believe role that will play effectively.
Well, I have personally heard from patients that it becomes very frustrating that they have to go to so many different places to find what they need and figure it out and interpret. So I think the need for AMD Central was to find that one location that people can come to and be comfortable at any place they are in that patient journey. And when the individual is ready, dig in and get more information. So we gave a uniform, kind of comfortable, safe place to start, and then offer more doors and pathways for more information. Because as organizations, we do want people to come and find out more about us individually, but AMD Central offers a way for that to happen at the time the individual is ready. And we're there to help the individuals when they're ready to come to us and find out more.
All of us shared that common goal, right? We all understood that in the end of the day, that's what it was about. Talk about advocacy and public policy at the federal level, and what Prevent Blindness is focused on right now, because I think that's a topic, and I may bring you back if you want to come back, because I'd love you to talk about that and get the word out and, energize people as a role they can play. So can you share that with us in the last few minutes?
Sure. And let me just expound on advocacy a little bit. When we talk about advocacy in our organization, and getting people to be comfortable with that, we want them to be an advocate on many different levels. So we have programs that help people advocate for themselves and their patient-provider relationships, to advocate for peers, to be involved in their community, to advocate for the needs of people with vision impairment, and then kind of the big A, advocating for policy change, whether it's at the state level or the national level. So it's really important to help individuals be engaged wherever they're comfortable. And there's a lot of different ways you can be an advocate. So I encourage all of your listeners to think about what they can do to make a change for the better for themselves as an advocate. And if you're interested in that big A, what are the important policy changes that impact those out there with MACD? Is for us as an organization, we really focus on appropriations, making sure there's money that goes to the CDC's Vision Health Initiative, and they conduct all of the surveillance of where the diseases are, who needs to get more help, more intervention, so that we can get program resources to those individuals. And right now, our country funds it at the level of a total of $5 million. For a national budget, $5 million is put forward.
What? Wait, can we just make sure people understood that?
That's 5 million with an M, not a B. 5 million. And so that is right now the resources that we have for national surveillance, knowing where to put information and interventions, and money to actually do some community level interventions. So there's two roles there that are happening with that $5 million. So we'd love to see that expanded so we can do better surveillance and certainly more community level interventions. Now, there's other areas of funding that we support as well, and that's certainly funding for research, which is critical also for this audience with AMD. So we need to make sure that we have good treatments, good therapies out there, and so we want to see funding for that as well. But we also want to make sure that we know where that treatment and therapy needs to go. So surveillance is also critical. You can't put all of your dollars for vision in one basket because there's a lot of different things that need to happen to make us successful in preventing it where we can or reducing it as possible. And then also we want to make sure that we have funding for other programs related to vision, but also encourage other governmental agencies to pick up vision where we can. We're a part of a group called the ITEM Coalition that's working on creating access to vision rehabilitative tools that might be covered under Medicare. Right now, they're not covered. So we want to make sure that there's access created. So that's an area of advocacy for us. And then also we'd like to see other government agencies such as the Administration for Community Living and the Administration on Aging picking up more information about vision and integrating it into their work. So there's a lot to be done and a lot of ways that people can get involved, but start where you're comfortable. Maybe you're just wanting to know how to talk better with your doctor. Maybe you want to help out a peer who's just been recently diagnosed with MACD.
And those things are related to what we did at AMD Central too. So it connects there. Yeah.
All those places to start are on AMD Central, and a lot of organizations are there to help you do that.
Will you come back next again and just pick one of those topics, because the Support Site Foundation is part of the ITEM Coalition, and I want people listening. We have a broad audience, but a lot of people listening, a lot of our followers have other chronic health conditions along with macular degeneration and losing their sight, and we don't have to say it too much because people listening know how much losing your sight changes your life significantly. And living with
you got to talk about the whole person.
You got to talk about the whole person
from head to toe, because you can't piece it out and think that we're taking care of them.
Right. So Medicare will pay for a walker. Okay. But on this show, we have a segment every episode about assistive technology, like you said, to help people live a more independent life, accessing those tools.
Right. And only 12% of individuals that need to access rehabilitative tools are able to access them. 12%.
12%. Wow. You've blown us away with those numbers. They're way too low.
They are all way too low. We need to do better. And it really starts with people sharing their stories and their needs. So I can't encourage your audience more than to share their experiences, because the legislators and policymakers need to know.
That's right. It's a grassroots effort. We're going to put a lot of this on the website, MyMacDLife.org. And thank you so much for joining us today. Thank you so much for being part of the founding members. I love working with you. And thanks for building that along with our other partners, or all of them are on the show on different episodes, and joining us to create this incredible resource out there, amdcentral.org. Thank you, Kira from Prevent Blindness.
Thank you, Dawn. I appreciate it. Thanks for having me.
This program is empowered by the Support Site Foundation. The Support Site Foundation mission is to save sight for millions of people who suffer from age-related macular degeneration, AMD. As a 501c3 public charity, our goal is to provide patient education and access to low vision resources to help individuals, families, and caregivers whose lives are severely impacted by AMD. The Support Site Foundation funds innovative research projects to discover effective new tools, technology, and treatments. The Support Site Foundation, supportsight.org, supportsight.org, or call us at 888-681-8773 and connect with us on social media. Thank you.
Thanks for being with us on MyMacDLife, the podcast with a vision to bring hope, optimism, perspective, and education to our listeners. For more information and many great, incredible resources, visit MyMacDLife.org. This program is supported by amazing listeners like you. Please consider a donation to keep our mission moving forward. Remember to subscribe to this podcast on iTunes or wherever you get your podcasts. Until next time, keep living with hope.
My MacDLife.
My MacDLife! Ah!